Welcome back to another video on the Student Physical Therapist. My name is Jim Hefner. I'm a private practitioner in Boulder, Colorado. And in this video, I'm going to give you a sneak preview of some of the online mentoring that I'm going to be doing coming up in the next few months. So I haven't set a date on that, but if you're interested, please keep a lookout in the emails, and then you can get on that waiting list, and then we can get you hooked up with even more information. But in this video, we're going to cover the 8 fundamental movement patterns. I'm going to go through these pretty quickly, and you're going to get a sneak preview of some of the underlying content of the mentoring sessions. So the 8 fundamental movement patterns, what are they? They are our squat, lunge, hinge, push, pull, carry, and then twisting and our gait pattern. So again, we have a squat movement, which is a bend at the knees, a lunge stance, which is going to be a split stance posture of the pelvis, hinging, which is a bending at the waist. So that's going to be more like our deadlift type of movement. And those 3 movements, the squat, lunge, and the hinge, that is our pretty much our only strategies for picking things up from the floor. So if you want to get stronger with getting things up off the floor, or you're working with clients on how to get better at picking things up from a low surface, it's going to be a squat, it's going to be a lunge, or it's going to be a hinge pattern. From there, we have our push and pull, and you could say that the squat is a lower body push, the deadlift is a lower body pull, but with those, I'm primarily talking about pushing and pulling from an upper body standpoint. Pushing is going to be pressing things away from you or pressing stuff overhead. A pull is going to be like a row type of movement or a lat pull down. That's where you're pulling things into your body. Carrying is going to be the ability to hold a weight, and that's important because our carry strength has been highly associated with longevity. So your grip strength, your ability to carry something is very important as an overall predictor of health. And then the other movements, which is going to be our twisting and rotational pattern. And then lastly, the efficiency of how we walk. And we typically think of gait or locomotion as this inbred thing that we all do. But as you can see from some people walking down the street, how somebody shuffles or how they bend through their knees when they're walking, or little limited toe off, those are all really important considerations for how well they're using their whole movement system. So these are the 8 fundamental movements. We're going to go through these quick. This is just an overview, and this is really to kind of prep you for more information to come. With the squat involves bending at the hips and the knees to lower the body towards the ground. The key principles of the squat are going to be hip, knee, and ankle mobility, core stability, quad and glute activation, adductor engagement. If you've ever gone deep down into a squat and held lumbo-pelvic position, or the bottom picture there, that kettlebell hold, you'll really feel how the adductors, as they pull into the pelvic girdle, are very important in the squat position. Otherwise, you have hamstring engagement, ankle stability, your foot placement is going to be huge, and then how you breathe through the squat is also going to impact how much leverage you can gain while squatting. The functional biomechanics of a squat, with the quote perfect squat, we're thinking about having a neutral spine. We need to hinge from the hip, so that's another one of the fundamental movements, but some sort of posterior weight shift where we're bending at the hips, lumbopelvic rhythm, the ability to load into the glutes and the hamstrings. So as I sit back into a squat, I want to feel the glutes and the hamstrings holding some tension there. Hip flexion. So as you go down into a squat, the hips go into a flex position. Knee flexion, the knees need to bend as you go down into a squat. And what's not on here is with knee flexion is that involuntary tibial internal rotation that has to happen. So if you see people that are really flaring out through their knees, it's gonna compromise somewhat the ability to flex the knees and get that natural tibial internal rotation. Lastly, ankle dorsiflexion, and then subtalar neutral or subtalar pronation, even where we're letting the arches drop so we can load down to then explode back up. That's the quick overview of the squat. Next, we have our lunge position. And unlike the squat, where both feet are together on a stable base, the lunge is this split stance posture where we're going to challenge the stability of the pelvis more. You've probably haven't thought about it, but why is the lunge not as strong as the squat? Well, in the lunge, in the squat, we have bilateral base of support. Both feet are stacked directly underneath you. It's a more grounded position. In the lunge, we're doing a split stance position of the pelvis. So the muscles on one side are pulling opposite the muscles on the other leg. And that split stance and that kind of more narrow stance of balance, even though it's a bigger base of support, makes the lunge inherently more unstable than the strong position of a squat or a deadlift. So the lunge involves stepping forward with one leg and backward with the other leg until both knees go down bent to approximately 90 degrees. The key principles of a lunge are you have to have hip mobility and stability, knee alignment and stability, ankle mobility and stability. Can you see how all the major joints of the lower body need to embody both mobility and stability? So they need to have flexibility and strength. Also on the back leg, the big toe goes into a lot of great toe extension, which is super important. Core strength and flexibility, because you need to be able to hold a neutral pelvis, or else you're going to really get pulled through one side of it, and it's going to take away your leverage to use your hip muscles. Balance is super important, and again, foot positioning and breath control. If the back leg foot is turning in a lot, that's going to draw the whole lower leg into more of a hip internal rotation position, and that weakens the stance of the lunge. From a biomechanics standpoint, we have a neutral spine. The sacroiliac joints need to counter rotate. So as one side is trying to control anterior pelvic tilt, the opposite side is trying to control a posterior pelvic tilt. And again, if that gets too torqued, we take up all the tension in through our SI joints. It really impacts the SI joints' function to distribute load throughout the body. So the ability to balance the anterior and posterior tilt of the pelvis is going to be super important. The front leg on a lunge goes into hip flexion, knee flexion, and ankle dorsiflexion. And then the back leg, you have to have adequate hip extension, knee flexion, ankle dorsiflexion, and then great toe extension. Also, because of the wide stance of the lunge, as I get deeper and deeper into a lunge, not only do we need to think about the hip flexors and hip extensors, but also the adductors as they pull into a deeper lunge stance are going to be super important for your overall mobility to get down into a lunge position. The third movement is the hip hinge. The hip hinge pattern, there's some component of a hip hinge in the squat, as I mentioned, but this is the ability to bend at the hips while maintaining a neutral position of the spine. This is a super important posterior chain movement. People that can't hip hinge, it means they can't use their hamstrings very well. And the way to compensate for that is they're going to use their spinal erectors to bring their body out of the position, or they're going to bend at their knees and try to use their quads, which makes them more kind of anterior dominant. And I say that in quotes because I want strong quads, but we need to have that symmetry or the balance between anterior and posterior chain. The key principles of the hip hinge are going to be hip mobility and stability, spinal alignment. And you can see in this person's picture, maybe you could say they're getting into some lumbar flexion. That's still okay as long as the load or where you're feeling the weight is going through the lower glutes, upper hamstring. Hamstring activation, glute activation. You need to have stability through the knees. You'll often see people, even as they go into a forward flexion position, but especially as their body loads forward under some sort of external resistance, that you'll see that the knees want to start dropping in. And that's a combination of their inability to hold the hamstrings in a neutral position. So it's going to be a combination of that. So you could say weakness of the outer glutes helping hold that position. And then also that knee stability is going to be a factor in how well can their ankles hold a position under an external load. Knee stability, foot positioning, and breath control are all super important. Hip hinge biomechanics, we want to see again a neutral spine. It's going to be flexion of the hips. The knees need to maintain that isometric hold of roughly 10 to 25 degrees. Subtalar joint is going to be in a neutral position. We don't want to see somebody flared out into supination. Or, as I said earlier, if they're collapsing through their ankles, then we're going to see that up the chain as the knees collapsing and the hips are internally rotating. Doesn't cause pain right away, but it's a weak position for movement. And then also we want to see from an upper body standpoint, if we're doing a deadlift, a neutral scapular position. So being able to hold the shoulders in a back sort of not fully retracted, but neutral isometric position. I said I was going to go through all 8 of these functional movements from a quick overview standpoint, but I want to stop at the squat, lunge, and hip hinge because that's a lot of information there. And I want you to know that If you think you want to do some of the online mentoring to learn more about these and learn how these movements, we can both progress them and regress them for clients, then we're going to get into the entire all 8 movements there. So that is a quick overview of the squat, the lunge, the hip hinge, some of the key components of it, and then the functional biomechanics. So I hope you enjoyed this video. If you want to learn more about these, I'm going to have tons of information coming out on all of these main fundamental movements. So stay tuned and thank you for following. If you like the video, please share it with a friend and subscribe. I'll see you soon.